In order to palpate the pectoralis major, you'll have your patient lay in a supine position with their shoulders slightly abducted, and then you'll feel the medial border of the clavicle and just feel slightly inferior to that, and you'll feel the body of that muscle. In order to stretch the pectoralis major, you'll have your patient put both of their arms on the sides of the door and lean forward until they feel the stretch in their chest. To strengthen the pectoralis major without equipment, you'll just do push-ups. And then with equipment, you can just do bench presses with weights. In order to palpate the latissimus dorsi, you'll have your patient lay in a prone position with one arm hanging off the table, and you'll feel through the lateral border of the scapula. And then the latissimus dorsi is just this thick band of muscle all to the lateral side of the lateral border of the scapula. To stretch the latissimus dorsi, you'll have your patient stand straight with their arms above their head, and then you'll have them lean to one side and hold for 5 seconds, and then lean to the other side and hold for 5 seconds. To strengthen the latissimus dorsi without equipment, you'll just have your patient perform Supermans. And then with equipment, you can do pull-ups. To palpate your subscapularis muscle, you're going to have your patient sideline and then ask them to flex their shoulder. And then you're going to find the lateral border of the scapula and take your thumb and kind of press down deep into that area, and you should be able to feel the subscapularis. To stretch your subscapularis muscle, you're just going to have your patient stand in the doorway and then have their arm at a 45-45 angle, and then ask them to lean through the doorway, and they're going to feel this stretch back in there. To strengthen your subscapularis muscle, you're going to lay on the ground on your back and then have your arm at a 45-45, and then you're going to take your palm and you're just going to tap the floor and then go back up. So you're doing internal rotation. And with equipment, you can do cable pulls with internal rotation.